Here's a question. How does one address the philosophical issues regarding healthcare as a right versus no support for government entitlement programs? What should be the role of the federal government and our role as citizens?
You know, we have a long-standing issue in this country. For example, if we compare education, education is considered a right. Every child and individual who is considered educable at whatever level is entitled to an education to the extent that their personal capacity allows that. We have never treated health care as a right in this country. And philosophically, we still obviously do not do that. So there is no philosophical or ethical inherent entitlement for health care in our national value system, unlike other developed countries, I might add. So I think about the level of political wrangling that's going on right now in the White House and in Congress, coming down to a philosophical level of whether it's a right or a privilege is probably not going to be on our radar scope in the immediate future. I mean, I'm a career public health person, so of course I believe that the access to health care and the right to health care is quintessential, but that's not a nationally shared viewpoint.
Yeah, I would just say that that is a sort of political dialogue that the citizenry needs to have, and I'm encouraged to see that there's been a fairly significant increase in the number of citizens kind of becoming activists in the sense of calling their congressman or showing up and participating. If you look at the healthcare expenditures, we spend about 17.5% of our GDP a year on healthcare. I think the next closest country is Norway, and they're at about 12%. And if you compare our health outcomes using World Health Organization standards, we are on par with the country of Slovenia. You can go Google search World Health Organization rankings, and this is nothing new. And personally, you know, I just think the wealthiest country in the world, in the history of man, doesn't believe, I mean, at least currently, that healthcare is a right, you know. And things are changing. The CHIP program, the Child Health Improvement Program, where essentially we guarantee health care now in the United States for all children at some basic level. And sort of the citizen activists that are, you know, people are showing up and saying, well, hey, what about me? I was watching on YouTube some of the videos of some of the congressional town halls, and this one particular senator said, well, we want to implement health savings accounts. And people said, yeah, but if I get cancer tomorrow, I don't have time to save $150,000 in my health savings account. So I think, you know, things are changing.
And you know, Philip, when we're talking about lower and lower middle income individuals, someone made a comment to me, and they read it somewhere the other day, that's like a health savings account for a middle or lower middle income individual is like giving a cookbook to a homeless person.
Right.
They're unable to amass the kind of savings that would cover any kind of major medical situation. And high deductible plans, which were one of the things that were touted by certain members of Congress, are fine if you have the $5,000 upfront payment that's required in order to get your premium down. This is not the answer.
Right. The other thing I would say is that to a pretty significant extent, many people are already in a single-payer system, depending on how you count it. Medicare, all the people,
coverage,
right, the VA, that is a socialized system. That's a single-payer system. People that are currently working for the Defense Department or in the military, there's a health system for them. People that work for the federal government, I think it's called TRICARE, but it's essentially a single-payer system for these extremely large populations. And depending on how you count it, between 40 or 60% of the population is being covered by one of these sort of pseudo single-payer systems. I mean, they're incredibly large. And so for the rest of the population that's covered by private insurance, with the ACA, they reduced the amount. They used to require that 70 cents on every dollar collected in premiums for health insurance had to be actually expended by medical insurance companies for medical care. I believe the ACA changed that to 80%.
85 and 80, 85% for large companies and 80% for small companies.
And so we have been slowly kind of migrating toward a single-payer system, and I think both politically and because it's more efficient. When the risk pools get smaller and smaller, you have to have enough reserve, so if someone in that risk pool gets an extremely costly illness, the whole insurance pool can bear that load. So when you get to small pools, it requires more and more of a sort of capital outlay to ensure that they can provide care for the sickest individual in a small pool. Well, the way you fix that is to get the largest pool possible. It's Insurance 101. You spread the risk over the largest population possible. The cost per individual decreases. And this supports what Kristina is saying. It's like a piece of fabric, and you start pulling at the string. A lot of the proposals people make are to shrink the pool. It's like, why should an 18-year-old pay into insurance that covers geriatric care? Why should a 60-year-old person pay into a system that provides maternity care? Well, yeah, if you want to break it into those small pools, but when you do that, then you lose the benefit of those large risk pools. And so it's kind of
and that is that's a philosophical issue.
Right.
That's, why should the 60-year-old pay for maternity care? Why should I be paying taxes to support a school system when I've never had children?
Right, exactly. And at least, in fact, there was a recent Supreme Court decision that just came down where the Supreme Court upheld that public school systems have to accommodate children with autism, so that if they're demonstrated not to be performing in the public school system, the public school system has to provide an alternative, because our society has evolved to the point where we all recognize there's a public good involved with providing public education to everyone. And in fact, that's evolved even for special needs children now.
Right.
We, for whatever reason, compared to our peer nations, collectively haven't had that philosophical conversation, although it's starting right now, and I think that's a good thing. So one of the good things to come out of sort of the chaos in Washington is I think the average citizenry is starting to think about this, and that's a very good thing.
Yeah.
We live in very interesting times.